Hey YouTube, it's me Sunkiss coming back for a quick baby update. As most of you know, I had the vertical sleeve gastrectomy last year, September 2010, and lost quite a bit of weight. I lost track of all of that, but most of you know I started at, I think it was like 248 when I had my second surgery. Started out at 248 and worked my way to 165 over the month. Okay. Then I came back, last month or so, forgot when, at my 5th week. Or what I thought was my 5th week, because I'm actually a little further along. What I thought was my 5th week, to let you guys know that I'm pregnant. So I won't be doing any more VSG updates because I am not going to be losing any more weight right now. After the baby, then we'll get back to the losing weight and the gym and going crazy. Okay? But for right now, I'm gonna let you guys follow me through my pregnancy. I want to share my pregnancy with you the same way I shared my weight loss journey with you. So, first off, I'd like to thank everybody again for all your well wishes. I didn't get a chance to get back to the comments, but it was really, really thoughtful of you guys to share the kind words with me and the blessings, and I really, really appreciate the support that you guys have always extended to me throughout my whole journey. So thank you for that. Also, thank you for the new subscribers, and for my old, thank you for staying with me and continuing to follow my journey and offer the support. Alright, so last week I had my first actual prenatal doctor visit. The very first one was the beginning of July, but that was just for like a history. I really just met with the nurse manager and we went over history, and she broke it down to me of what's going to happen and different things of that nature. So this was, then I went for a couple of sonograms thereafter, so they could pretty much pinpoint where I was in the pregnancy, because I lost track of my period, so we couldn't really tell from that. So last week I met with my doctor for the first time, which was so exciting. So funny because she has the same last name as my boo, baby daddy. So yeah, she's really, really nice lady. I really like her, and I feel very comfortable with her, and she took her time and explained like so much different stuff and answered all my concerns. I've been telling you guys I'm 39 years old and this is my first baby, so I had a lot of concerns of whether or not and plus because of the surgery and all, so I had a lot of concerns on whether I would be in a high risk category, whether I have to do all these tests and different things like that. So, and the issues with birth defects and different things that you worry about as you get older. So she answered all my concerns, and she said that 80% of her patients are in my age range. So she told me not to worry about it, that pretty much have really healthy babies. She doesn't consider me high risk at all, because my tests, most of my tests, well, all of my tests came back normal. Pretty good. I'm going to have a special test done in my 12 and a half weeks, in a couple of weeks. I'm going to have a special test done. Oh, by the way, guys, I am actually 10 weeks pregnant as of today. I was a little off. That's why I was waiting to meet with the doctor, because the sonogram tech, tells me one thing, but then when the doctor actually views, they say another thing. So when I met with her last week, she says, oh no, you're 8 weeks and 6 days. That was last week Wednesday. So as of Thursday, I have made 9 weeks. So today, from Thursday to Thursday, I count another week. So as of today, I'm 10 weeks. Woohoo! And my little baby is actually really a size of a prune. That's how small the baby really is inside of me. It really is an actual size of a prune, because I looked it up how, big your baby is at 10 weeks. And it really is the size of a prune. So it is my little prune. So yeah. So She doesn't think that I'm going to fall into the high risk category for right now because, you know, everything is pretty good. So we'll see at this special test. It's a first trimester screening that I'm going to have done in a couple of weeks. And it's what it is certain blood tests to test for Down syndromes and different birth defects. And they're going to do also a special like ultrasound, which I'm excited because I get to see my baby again. And, you know, see the heartbeat and all that stuff. I'm always excited for that. So, yeah, my mom wants to go to this appointment with me. She doesn't even want Daddy to go. She's like, okay, he went to the first one. Now it's my turn. I was like, okay, Mom. Yeah, I don't want to steal her joy, you know. So they're gonna alternate. So yeah, she's so super excited. She has to totally be there. But yeah, that kind of gives him a break too, I guess. You know, he doesn't have to go on every single appointment. As long as I'm fine, you know, I'm good with that. And plus he works too, so it doesn't make sense for both of us to have to take the day off from work, you know. So we'll, you know, they agreed they'll alternate. My mom goes to one, he goes to one, you know. So it's great that I have so much support. I'm really so happy. My family is ecstatic, okay? They're like going crazy already. These people are totally so excited. So my baby is so loved and not even here yet. Has people fighting actually over my baby shower. My cousins were physically on Facebook fighting over who has control. So that's a good thing. Romeo! Oh God, my dog. Oh, that's another thing, guys. I am actually going to be giving up my dog. Romeo! Oh my God. I have to stop my tape. Somebody's actually at my door. Hey guys, sorry about that. Someone's at my door, and you see how my dog goes off, right? He totally, he's very territorial. He's a territorial dog. His testosterone level is extremely high at all times. That's just the way he is. So, as I was saying, now I hate this now because now I had to stop the tape and I'm starting a new video, and y'all know that I'm not technically inclined with all of this stuff. So now I'm going to have to go into an editing thing to find out how I'm going to connect these videos together. That's why, because I don't have a pause button, you see. This thing just has record and stop on here. So now I'm going to have to figure out how to connect this stuff together. I hate this now. And I'm not trying to start the video over. I can't go through all that because y'all don't know I'm so sleepy right now. That's another thing too. You know, y'all don't see me in the videos. This last couple of videos, I have not been glammed up, diva'd up, hair down, and you know my little makeup, how I be doing and all fly and everything. Because I am tired. Pregnancy is very, very draining, you know. And babies are like little leeches. You know, they suck on, take everything from you. You know, and I am extremely tired, exhausted, so sleepy all the time. No matter how much I sleep, I'm still sleepy. So, yeah, I'm not glammed up right now, but it's gonna, you know, it's gonna come back. I'm still a diva, y'all. Yeah. So, anyway, as I was saying, I have to give Romeo up because it's gonna really hurt me because I've had him for 7.5 years now, you know, since he was about 3 months old. And it's really going to hurt me. I'm contemplating going back and forth with it. I found a really good home for him already, you know, but I'm still hesitant. I haven't actually given him away because it's killing me. Because I love him so much, you know. But I think it's best for him. He's a really small little Maltese dog, you know. He only weighs 7 pounds. And when I bought him, you know, they told me when I was doing research on him, it's not recommended that these little small dogs are around small children because children are going to be children and they, you know, sometimes a little rough with the animals. And he's going to defend himself because he has done it before. He's not a dog to really bite, but he has nipped my niece before and my one of my girlfriend's kids. You know, because they were too rough. And I told him, you can't pull him like that. He's not used to that. You know, and he nipped them on their fingers, you know. And so I'm scared for, you know, for him, for the baby, because I know the baby may be a little rough for him, you know, not knowing, you know, because the baby wants to know what is this, and they're venturing off, and, you know, he's going to defend himself, you know, because he thinks you're going to harm him or hurt him. He's being a dog. And not only that, you know, he's used to being the only baby. He's used to being, you know, the center of attention or whatever. So I don't know how he's going to handle that. And as you witness how he is, he's a loud dog. He barks really loud, like a lot. You know, if you know, and I live in a building, and if there's traffic going in and out, he's gonna bark. Okay, and he's gonna wake up my baby, and there's gonna be issues because I can't go through that. You know, back and forth. So I just think it's best for everybody that you know, let him be in a home, kid-free, you know, where they can love him, and, you know, he's the center of attention. There's no other dogs around because he doesn't like other dogs either. It's a very funny little finicky dog. You know, he loves me to death. He's very he loves his owner, and you know, he worships the ground I walk on. Okay, but he's not really into like everybody else. You know, and kids and all that. He's a dog that wants his own reign, you know. So I think it's best, that's his personality. I think it's best that I give him to somebody that can offer him that, because right now, you know, I got to think about the baby, and I can't really offer him what he needs, you know, when the baby comes. So I'm already preparing for that and trying to get myself together, pull it together to give my first baby away. It's going to be so hard. I know I'm going to cry. I love him so much. Anyway, done with that. So I have gained, get ready, because I've gained, you know, I've been telling y'all I didn't gain no weight, right? See, this is where I'm going to have the issue with y'all, because y'all know how much it means to me to be at my goal weight, you know, and I was even going to try to shoot for that 160. I really was going to try to shoot for that 160, y'all. Y'all don't know. I was on my way. But anyway, there's another plan for me. So I've already gained 5 pounds, y'all, and I'm not even out the first trimester. You're supposed to gain about 5 pounds, the average woman, in the first trimester. Okay. Hello, hi. I had no morning sickness at all, no throwing up, no nausea, no none of that, and my appetite has picked up. Yes, it has. I still can't eat like a lot in one sitting, but I find myself eating. I can eat really like every hour and a half, 2 hours, you know, and like I want to eat like stuff that shouldn't be really eating, snacking on, you know, like potato chips and sweet stuff, and just stay away from that. So I bought a bunch of fruits and stuff like that, you know. I have good and bad, I have good and bad days. You know, I don't sit there and eat potato chips every single day, right? But I have cravings and stuff, and I can't use that for excuses, so I gotta get myself together, because I have to remember all this weight that I'm gaining, I'm going to have to lose it all. Y'all know how hard I work. I bust my ass in that gym, man, to get to my goal weight. I bust my ass. I mean, I really did. It was not a joke. Blood, sweat, and tears to get to my goal weight. You know, I worked hard for it. So it wasn't just a surgery. You know, I really technically bust my ass. So, but I'm gonna get back there, but I'm not gonna worry about it right now. I'm just gonna try to eat a little bit more healthier, and the weight gain is gonna happen. It is what it is. You know, I just don't want to. I'm not trying to go out the wonderland. I can't go back to 200-pound mark. I just can't. I can't. That thing would depress me so bad. I'm telling you right now, I just can't do it. I cannot do it at all. So right now I'm 170. Okay, I didn't want to go more than 25 pounds, 20 to 25 pounds. You know, so let's see, 190. Okay, 190. So I'm really gonna have to try my best, you know, to really just make the right choices, not watch what I'm eating, just make the right choices. I can still eat and have these things, but I just have to still make the right choices. I can't just use the excuse that I'm pregnant and my hormones You know, same thing with when we're having our cycle. You know, our hormones, same issues that we have as women. It's a lot that women go through, you know, to keep this weight off, and these hormones that these guys don't get that we do. I mean, it's really a lot for us. Technically, it's a lot. So this is going to be the struggling part for me of my pregnancy, and the more so of the depressing part, I guess, of the pregnancy for me will be the weight gain, because I never wanted to gain weight, but you know I have to gain weight for the baby, and I have to eat for my baby, you know, to be strong and healthy. And I'm going to need my strength too, because I'm going to breastfeed. You know, I'm definitely going to be breastfeeding my baby, so I have to do what I have to do. So that's another reason why I know this is going to be long now. I'm going to lose the weight faster after the baby, because I plan on breastfeeding, you see, and typically that's like 500 calorie you lose a day with breastfeeding. That's why women that breastfeed their children, they lose their baby weight a lot faster. Okay, I do have to eat more calories, you know, when I'm breastfeeding, but I will be taking them off through breastfeeding. You know, your body is building up the milk, but the baby's taking it away. Also, one more thing I wanted to mention to you guys is that, you know, for my blood test last week, when I went to the doctor, you know, they told me that I'm anemic. So I've never been anemic in my life. Even after surgery, my blood levels and everything was fine, you know. But like the doctor explained, she said babies are like little leeches, and they, you know, they take from you, and you have to build yourself up so that you don't lose, because they're going to get what they need, and they're going to leave you all messed up. So, you know, I wasn't taking my calcium citrate before and how I should have, you know. So I went out and got some other ones, because I didn't like the ones with the taste. I didn't like it at all. So I went out and got a bunch of vitamins and stuff like that I'm going to be now taking to build myself up. This is probably why I've been so tired too, because now I'm anemic. And anemia is typical in pregnancy. It's very common in pregnancy. So these are my prenatal vitamins that I take. See, this is the size of it. And they're not that big, so it's not too bad. And this is more like a gel. It feels more like a gel, so it goes down a little easier. They're bigger than what I would like to take, but it's okay. You know, I can take them without a problem. These are cod liver oil tablets, soft gels actually, that I take. The required amount says 3 a day, so I take 3 a day. And see, they're little gel things. This is good also to take. It wasn't recommended by the doctor. She didn't, you know, typically recommend that I take it, but my mom did. She thought it was really important that I take the cod liver oil to help keep me strong throughout the pregnancy as well. This is the iron that they have me on. Now, I was scared to take the iron, because a lot of people say, oh, you're going to be constipated. Well, I haven't been constipated yet. She recommends that I take 3 of them a day, but I do take 2. You know, we'll see how it goes when I go back, if my blood level is still low, because it wasn't that low, but it was low enough for her to call me anemic. These are small. They're very small. So I take 2 of those a day, 1 in the morning and 1 in the evening. She recommended that I take vitamin C along with so the absorption would be better, and I wouldn't be so constipated. And I guess it works. Along with the cod liver oil, I haven't been constipated. I have no problems with that at all. And these are the vitamin C pills. So I take 1 of those a day. So I have like this little regimen every day with all these vitamins and pills that I take. This is the regular B12 that I was been taking all along. You know, the little tab that you put right under your tongue and it melts. I wasn't taking this every day because it wasn't required by my doctor to take every day. But now that I'm pregnant, I need it. I take it every day. And lastly, my Citracal, calcium citrate. So these are the petites actually, and they're smaller than the regular ones. I just didn't like the ones with the flavor anymore. They were so disgusting. I couldn't find one that I really liked. So I take the ones that I just swallow now. You know, I'm way post surgery. This stuff doesn't bother me anymore. You know, people that are just coming out of surgery, you don't want to use these. You want to take the ones that you could actually chew, because it's hard for you to digest all this pills and stuff like that right after surgery. Stuff gets stuck and you have issues, you know. So I wouldn't suggest this for somebody that's just coming out of surgery. But now, you know, I'm still going post surgery. What am I, 11 months now or something? I don't even know anymore. But yeah, this is August is my 11th month. I'm not quite 11 months yet, but I will be on the 13th. So yeah, this is the petite one, so they're not so big, so it's not bad. So yeah, there's a whole bag of vitamins that I take, and I probably should be taking some biotin, extra biotin stuff too, even though this I think has biotin in it. I mean, it has listen, these things have so much stuff in them. It's crazy the amount of stuff that's inside of these what are these? Prenatal pills. It's another thing, my brain is a little fried. Anyway, I don't want to keep you guys any longer. I know that when I combine this is going to be so long now. It's already 14 minutes and the other tape was like 7. Sorry guys, it's a really long video. But, you know, I just wanted to update you guys on what's going on. I'm not doing a body shot in this one. I mean, my pants are kind of like open. I guess I could just stand up really quickly. But, yeah. So it's just 5 pounds. My pants are fitting me differently, guys. I don't really have any, you know, I still wear maternity Spanx. I don't know what it is, those Spanx. I can't really button my pants. These are still a size 8. The legs are still big on me because that's how my legs are. But, you know, the middle was what's always been my problem. So that's, of course, is where the weight is, I guess, coming. The baby isn't up here. The baby is down here. However, my uterus and everything is growing. So the doctor says I will start to, you know, form up here pretty much, you know, before I form down here. Probably at the 12th week, this is when this will start to come out and I'll have, you know, an actual baby bump. But I'm very, how do you say it? I'm like, I don't know how to say it. Like I'm swelling up up here, I guess. I don't know. I'm bloated. I'm bloaty. That's the word I mean to use. I'm very bloaty up here. And it's because my uterus is growing, you know. So, yeah, not really a baby bump yet. 5 pounds. Gonna gain the weight. It is what it is. I'll lose it later. It's okay. I'm gonna try to enjoy everything in my pregnancy. Anyway, sorry guys. I'm so long with this video. I'll see you guys hopefully next week, if not the following week. I hope you guys are doing well with your weight loss. Keep on going. Keep me in your prayers. I'm almost out this first trimester, which is the risky stage. So keep praying for me, guys. All right. Love you guys. Thank you for viewing me. See you next time. Bye.